Hey guys, this is the doc. Doc to me. I'm taking a break, and I was just kind of pondering a recent question I got earlier today about what exactly comprises anxiety as a medical condition. In North America, it's a major headline. Top 50 most prescribed drugs in the past 3 years, 4 years, heck, in the past 20 years for crying out loud, but especially more recently, have featured a lot of anxiety medication. In 2021, about 9 or 10 of the top 50 were anxiety meds. In 2022, about 10 or 11 of them, depending on how you classify, one or two of the items on the list.
In 2020, medical expenditure data across the U.S. collected by the NIH household surveys, subsampled household surveys, and curated by the CDC, estimated that approximately 16.5% of U.S. adults were prescribed medication for either anxiety or depression. This includes SSRIs, serotonin reuptake inhibitor products like Zoloft or Paxil or Celexa, as well as benzodiazepines like Xanax. That's 1/6 of the American adult population in 2020. That represented an increase that was understandable, given everything going on in the world in 2020. And yet, that clearly does not account for folks that were homeless or institutionalized in, say, a nursing home or the prison system and a few other categories. So that number was most likely higher. That's quite impressive.
We could probably imagine there are probably some extemporaneous factors like COVID and that doomsday feeling everyone kind of went through in that panic that year. But the truth is that the trend kind of bears out that way most years. Anxiety comes in all sorts of looks. Do I look anxious? Yeah, I'm probably a little anxious. Everyone's got a little bit of this. Anxiety, to answer the question of what is anxiety or what comprises it, often has been studied as being produced by both external and internal factors happening outside of the body, outside of the physical body. Stressors around family, around work, around folks with gambling issues, around the outcome of a sport they bet on, or some other stake that you hold in, things that you have only so much control over, and stress quite a bit about what might come of it. For others, it's just the world we live in politics and culture and so many other elements outside of that. For others, when we talk about internal factors, it's often a matter of an imbalance in the neurotransmitters in the brain, whether it be dopamine levels, or it be acetylcholine levels, or it be norepinephrine levels, neurotransmitters that all need to find a particular balance in order to level our moods. And all too often, through almost very little, if none, in the way of external factors, you find folks anxious. You're looking around at their lives and you're going, how are you anxious? I don't see any stressors in your life. I live with you, for crying out loud. Things are good, and yet you're anxious? Those are cases where internal factors tend to kind of play a role. And sometimes there's a familial or genetic aspect to it, and sometimes a little bit less of that, maybe something spontaneous in this particular individual that has little to do with familial traits. Anxious folks will either freaking out and eating too much, or getting a little too anxious, they're not eating, they're losing weight, or they're not getting sleep. Some of the anxiety meds, as a matter of fact, that are quite prominent in medicine are meds that help with sleep as well. And there are so many other elements that play into it. I think the big deal in all of this is that the anxiety elements that affect us are very varied. But medicines in the benzodiazepine class, Xanax, Ativan, and the like, all tend to help with this. Folks will often ask for Valium. Folks will often ask for Neurontin, not approved for anxiety, but often prescribed for it lately. Some would need meds like Ambien, Lunesta, that class of medications to try to help get some sleep, because anxiety is affecting that the most. And I could talk for a lot longer about anxiety. I could get more technical about it, but I'm trying to keep it rather empirical. If you or anyone you know or love is dealing with anxiety, it might be time to have them see their primary care provider for some basic starter meds, while they maybe get worked up a little bit more in depth by a psychiatrist.
You can check out my next 3-minute video on depression up above.
This has been the doc. Doc to me.